Almost 1 in 3 adults have prediabetes, and most don't even know it. The good news: prediabetes is completely reversible with the right changes. Hi everyone, I'm Dr. Bazgha Khalid. I'm a board certified internal medicine and obesity medicine doctor, and I diagnose and treat prediabetes in my clinical practice every single day. In today's video, I'll break down what prediabetes is, how common it is in US and worldwide, what are myths versus facts, how to prevent and reverse prediabetes. I'll give you 10 practical and research-backed tips. You don't want to miss number 8. And I'll also talk about what to watch out for and what to ask your doctor. Stay till the end. I'll share simple daily habits that can make the biggest difference, plus a quick checklist to track your progress. Let's start with understanding what is prediabetes. Prediabetes means your blood sugar levels are higher than normal, but not yet high enough to be called diabetes. Prediabetes is a warning sign. Your body is developing insulin resistance and your pancreas is working overtime to keep blood sugar in range. Let's understand prediabetes diagnostic numbers. According to the American Diabetes Association, fasting blood sugar from 100 to 125 milligram per deciliter, hemoglobin A1C of 5.7 to 6.4, 2 hours glucose after oral glucose challenge of 140 to 199 milligram per deciliter. All of these are diagnostic for prediabetes. So if your blood sugar numbers are in these ranges, it's a sign that your metabolism is struggling and you have prediabetes. But it's not too late to turn things around. So how common is prediabetes? Prediabetes is extremely common worldwide. As of 2023, the International Diabetes Federation estimates over 480 million people globally have prediabetes or early glucose impairment. In the United States, the CDC reports about 96 million adults, nearly 38% of US adults have prediabetes. What's alarming is that over 80% of them don't even know it. Let's talk about the science and understand how prediabetes happens. Prediabetes develops when your cells stop responding properly to insulin. Insulin is a hormone that moves glucose or sugar from your blood into your cells for energy. When your body stops responding to insulin, this is called insulin resistance. When that happens, your pancreas makes more insulin to compensate. Over time, your pancreas cannot keep up and blood sugar starts to rise, resulting in prediabetes. Let's talk about myths versus facts. One of the myths is that prediabetes always turns into diabetes. This is not entirely true. Fact is, studies show 30 to 70% people can reverse prediabetes with lifestyle changes. Another myth is that you cannot fix your blood sugar without medications. Fact is, weight loss, exercise, and diet can normalize blood sugar for most people. So a healthy lifestyle is the best medicine for your body. Another myth is that prediabetes doesn't cause symptoms. This is often true, but in fact, subtle signs like fatigue, increased hunger, or belly fat gain can be signs and symptoms of insulin resistance or prediabetes. So if you feel sluggish or have any other vague symptoms, it's best to consult with your doctor for some simple blood tests. Another myth is that thin people can't have prediabetes. Fact is, insulin resistance and prediabetes can happen at any body weight. Let's talk about the most important thing: prevention. How to prevent prediabetes. Remember that even small changes can make a big difference. A 5 to 7% body weight loss, about 10 to 15 pounds for many adults, can cut the risk for developing prediabetes and diabetes by more than 50%. The Diabetes Prevention Program, published in the New England Journal of Medicine in 2022, found that lifestyle changes were twice as effective as metformin in preventing diabetes. Metformin is one of the most common oral medicine used to treat prediabetes and diabetes. So, what we know from clinical research and clinical experience is that a healthy lifestyle is twice as powerful as a medicine like metformin. Now, that is amazing. If you are already pre-diabetic or have insulin resistance, let's talk about 10 steps to reverse prediabetes and insulin resistance. Now, these are all backed by clinical research as well as extensive clinical experience. Number one, focus on protein and fiber. Protein helps stabilize blood sugar and keeps you full. This helps reduce insulin levels and therefore prevents insulin resistance. Aim for about 100 grams of protein per day. Of course, protein recommendations can be customized based on your lifestyle, health goals, body weight, and other factors by your doctor or nutritionist. However, the goal of 100 grams of protein daily is a good starting point for most adults. Let's talk about fiber. Fiber, especially from vegetables, beans, and oats, slows sugar absorption, reduces insulin spikes and insulin resistance. Aim for 25 to 30 grams fiber daily. Fiber only helps along with adequate hydration. Your body needs water to make fiber work. So hydrate, hydrate, and hydrate. Number two, cut back on added sugar and refined carbohydrates. Think of this as limiting white bread, pasta, pastries, and sugary drinks. These highly processed foods spike blood sugar quickly, leading to insulin resistance and prediabetes in the long run. Number three, move after meals. A simple 10 to 15 minutes walk after eating can lower post meal blood sugar by 30%. This means that your body can metabolize food better, leading to less sugar spikes and better sugar control. In the long run, this can lower your chances of insulin resistance or prediabetes. Number four, lose even a little weight. Research shows that losing just 5 to 7% of body weight reduces prediabetes and diabetic risk dramatically. Number five, improve sleep quality. Poor sleep causes stress. This increases the stress hormone called cortisol in the body and leads to cravings for carbohydrates and causes insulin resistance and prediabetes. Aim for at least 8 hours of consistent quality sleep. Number six, manage stress. Chronic stress raises cortisol, which increases blood sugar. Try meditation, deep breathing, walking, or journaling. Number seven, track your progress. It's best to know your numbers. You want to know what your fasting blood sugar is, and you want to also know what your hemoglobin A1C is. Hemoglobin A1C is a 3-month average of your blood sugar. So if it's been a while since you had these labs checked, then please go see your doctor for some basic lab tests. And then it's best to monitor these numbers every 3 to 6 months. Some people use continuous glucose monitors for real-time feedback. And I personally use a continuous glucose monitor on and off to learn about my sugar responses. And this has helped me understand food and other things that impact my blood sugar in a good or a bad way. This way, it becomes easy for me to make changes as I get real-time feedback. Number eight, add strength training. Personally, this has been a game changer for me. We usually think of muscle only in terms of strength or appearance, but muscle is actually a metabolically active organ that plays a central role in overall health, weight control, and even how long we live. We start to lose muscle as early as in our 30s, especially women. So strength training is key to prevent muscle loss. Also, building muscle improves insulin sensitivity. Even 2 to 3 resistance workouts per week help preserve and build muscle. Number 9, consider medications if indicated. Now, let's say if you are pre-diabetic and you're already prioritizing protein and fiber in your diet and avoiding processed food and doing strength training, but not seeing any improvement in your numbers, then remember, prediabetes is a metabolic issue with a strong link to genetics and epigenetics, and so many other factors beyond our control. So now this may be a good time to talk to your doctor about medications. To prevent progression of prediabetes to diabetes, Medications like semaglutide with brand name Ozempic or Wegovy and tirzepatide with brand names Mounjaro and Zepbound can help people with overweight or obesity and prediabetes. These medications help improve insulin sensitivity and reduce chances of progression to diabetes. Number 10, consistency over perfection. Prediabetes doesn't develop overnight, and neither can we reverse it overnight. So aim for steady, sustainable progress, not quick fixes. Simple changes done consistently have a big impact over time. So, what is the risk for progression of prediabetes to type 2 diabetes? Without intervention, up to 70% of people with prediabetes will eventually develop type 2 diabetes. And type 2 diabetes increases the risk for heart disease, stroke, nerve damage, kidney disease, vision loss, and so much more. But with early action and intervention, the majority of these outcomes are very preventable. So, what are the do's and don'ts to prevent or treat prediabetes? Do's are eat balanced meals with protein, fiber, and healthy fats. Exercise regularly. Stay hydrated. Sleep, stress management, and get routine labs checked. Don'ts are don't skip meals and binge later. Don't ignore your lab results. Don't wait until diabetes develops. Don't skip medical follow ups. Don't overdo sugary drinks or highly processed foods. Don't depend solely on supplements or detox plans. Don't ignore fatigue, frequent thirst, or urination. These could be early warning signs for prediabetes. So, how about monitoring and questions to ask your doctor? Monitoring, like hemoglobin A1C, this is 3-month average of your blood sugar every 3 to 6 months, especially if you're already pre-diabetic or have risk factors like overweight or obesity or family history of diabetes. Fasting blood sugar. This should be checked routinely at least once a year, again more frequently if you have risk factors. Weight, waist circumference, and blood pressure monitoring regularly, at least once a year, of course, more frequently if you are overweight or have other risk factors like family history of diabetes or prediabetes. So, what are the questions to ask your doctor? What's my hemoglobin A1C and fasting sugar trend? How can I safely lower my blood sugar? Should I see a nutritionist or a diabetic educator? Do I qualify for medications or clinical monitoring? What's a realistic timeline to see improvement? Key takeaways are prediabetes is your body's early warning system, not a life sentence. With the right nutrition, activity, sleep, and medical guidance, you can reverse prediabetes and take control of your health again. Remember, the goal isn't perfection, it's progress. Small, consistent changes make the biggest long-term impact. If you found this video helpful, please give it a like, subscribe, and share it with someone who needs to hear this message. Together, we can make healthy living simple and doable. Stay healthy, happy, and well. Bye for now.